Hey, quick question. What's an independent physician assistant? What does that mean? Do you get more credentials besides your name? Like right now it's just PA-C, which is, I know we used to have a joke in physician assistant school that all you need to pass is just to make a C. By the way, my GPA was a little bit higher than that. So, well, quite a bit higher, but it was just a running joke we had. Anyway, so will I add, as an independent physician, do they just get to add more credentials to their name? Do they do more medical training? Like, what does that mean? Well, in the state of Oklahoma, at the end of August of 2025, a new rule went into effect, which thank you to the legislators who passed this bill. And essentially what it means is that physician assistants who have a certain amount of hours behind them after they've graduated that were supervised by a physician, because we, as a physician assistant in most states in the United States, need to have your licensure attached to a physician, who we call a supervising physician, who signs off on your medical charting, your notes, your diagnoses, your intake forms, and then your prescriptions. You're always tag teamed as a physician assistant, largely in the United States. But here in Oklahoma, we recognized a need, and they produced this bill that allowed for the unhooking, which is pretty progressive, and definitely the wave of the future. But they allowed the unhooking at a certain point in time for physician assistants to break free from the need to have that medical licensure supervision of a physician over you, which could have been either a medical director, an MD, or a DO. So, interestingly, that happened in September of 2025. And when it happened, it was not necessarily like an all physician assistants raced to get it. But I did sign up. I was one of the first 20, I think, as I was looking through the charts of it, and who was documented and things. But what had to happen for me to become an independent physician assistant was I had to have a certain amount of hours. I believe the technical hours were 6,240. I need to go back and look. But 6,240, what it equivalated to, if you math that out, is three and a half years of full-time work, essentially. And by that time, I'd had 8.5 to 9 years. I had had 11 years behind me. I was thinking of my former hospitalist days. That was 8.5 to 9 years. I then had private practice experience for about 3 to 4 years plus after that. And so I contacted one of the supervising physicians that I'd worked with most closely and long-term with, and he was very gracious, and he says, yes, I will certify that you did those hours, and that you are someone, because you not only have to certify that you have that many hours behind you in post, let's say, it's not postdoctorate because we didn't have a doctorate, but in post PA school training, essentially, but they also had to certify you as the individual as a capable medical professional, because certainly we don't want to just let people kind of do their own thing, you know? So he was very, very kind, and I owe him a lot and a big thank you, but he signed that officiating affidavit kind of sheet. We submit that to the medical board reviews it, and then they approve it, yay or nay. And so an independent physician assistant, what that means is that I no longer need to have my licensure attached to a physician for the services that I can provide to people prescriptively, with one caveat. And to also order lab work in the state of Oklahoma, to also diagnose and treat, to submit claims to insurance, although I'm sure there's a little bit of an evolution of that because everybody has to kind of catch up with the law. And so it really allows me to do what I've been trained to do for the last 10 plus years, but now just on my own without a signature of another physician attached to that licensure that I have had for the last however many years.